erectile dysfunction. I said it. Yeah, we joke about it, but if it ever happens to you, it's no laughing matter, and it's incredibly common. Studies show that about 50% of American men over 40 will experience it at some point, and yet we almost never discuss it because it's tied to our sense of masculinity and confidence. Here's the good news. It is usually manageable, and in many cases it's reversible. So here's a way for us to break it down, why it happens, what we can do about it in a way that's honest, practical, and hopefully encouraging. So erectile dysfunction happens whenever blood flow to the penis is restricted, making it tough to get or to keep an erection. Now, that can be because of physical issues like narrowed blood vessels, which is common with cardiovascular disease and diabetes, nerve damage, or the side effects of medication. There's psychological factors like stress, anxiety, depression, or relationship struggles, and lifestyle factors like smoking, drinking, lack of exercise, poor diet. It all adds up. So it's rarely one thing. It's a complex combination of physical, emotional, and lifestyle-related factors. Now, the most well-known treatments to medications like this are Viagra or Cialis. They work to boost blood flow to the penis, and they're effective for many men. Now, some people don't like the side effects, but what Viagra has done has made it much more welcome for us to talk about it as men without any stigma or shame. But here's the catch. They don't address the root cause. If your ED is due to high blood pressure or diabetes or low testosterone, a pill might help in the moment, but it's not going to fix the underlying issue. So what other options are there available to you? Well, there's testosterone therapy, vacuum devices, or implants, which are helpful for some, but clearly not for everyone. And then there's some nutritional and functional approaches. So whenever it comes to what I would suggest as a medical herbalist, I want to look at the whole system, not just your symptoms. So first and foremost is garlic. It's great for cardiovascular health. It improves blood flow, lowers blood pressure, and supports nitric oxide production, which is crucial for erections. Ginkgo biloba enhances blood flow and is especially helpful for men whose ED is linked to antidepressant use. Panax ginseng, known as a natural Viagra, relaxes blood vessels and improves erection quality and satisfaction. Tribulus terrestris supports testosterone production and blood flow, improving erection quality. And then there's ashwagandha, which reduces stress and supports hormonal balance. It's great if your ED is connected to anxiety or burnout. And horny goatweed, which contains icarin, which boosts nitric oxide and blood flow. It's been used for centuries in Chinese medicine for sexual vitality. Damiana, or Tenera diffusa, is a natural aphrodisiac that improves blood flow and reduces anxiety around intimacy. And maca root, which boosts energy, libido, and overall sexual performance. Yohimbe enhances blood flow and nerve signaling, but it does need to be used with caution, and it is to be avoided if you have heart disease or heart issues. And then there's shilajit, a mineral-rich resin that boosts testosterone and energy, and it's shown to significantly increase testosterone levels in men. Now, a little spotlight on pine pollen. It's a natural phytoandrogen, and it's a powerful ally. It's literally the pollen from pine trees, and it's been used in traditional Chinese medicine for centuries as a tonic for male vitality and longevity. Why is pine pollen special for men's sexual health and for erectile dysfunction? Well, it's one of the only plants that actually contains phytoandrogens, plant-based compounds that mimic human testosterone. Pine pollen is rich in vitamins, minerals, and amino acids and antioxidants. And what really sets it apart is its ability to help balance hormones naturally. Now, some studies and a lot of traditional use suggest that it is used to gently support testosterone levels, boost libido, and even support erectile function, especially if your ED is linked to low testosterone or hormonal imbalance. It's also anti-inflammatory and supports overall energy and recovery, which is key for men dealing with stress, fatigue-related ED. Now, diet and lifestyle make up a huge part of handling and tackling ED. So foods that support nitric oxide include beetroot, leafy greens, and those rich in zinc, pumpkin seeds, and oysters for testosterone. Exercise regularly. Cardio and resistance training both improve circulation and hormone balance. Manage your stress. High cortisol or shift work suppress libido and testosterone. Quit smoking, limit alcohol, and get enough sleep, 7 to 9 hours preferably. Now, do not underestimate the saunas, steam rooms, team sports, martial arts. These are good for your body, but they're also good for your confidence and for your mental health. Studies show that positive male social networks lower anxiety and depression, which indirectly benefits sexual health and performance. Talk to someone. A doctor, a mate, a counsellor, you're not alone. Viagra's 70 billion first year of sales has shown that you're not alone. So it is a chance for you to make real change. Be patient. Progress does take time. It does take a few weeks for it to work, but small wins are possible. And erectile dysfunction does not have to define you. With the right mix of it, conventional and natural approaches plus a commitment to your own health, you can really regain confidence and intimacy. Millions of men face this challenge and countless have overcome it. So let's keep the conversation going. You can check out more on the Health Hub here on YouTube or more resources that I have on my website, www.thewildsage.co.uk, and take a next step towards reclaiming your health and vitality.